So today we're going to be spending our time with you really providing an overview of governance for health equity. More specifically, we're going to be talking about some really key principles and elements of governance. And Jodi's presentation is really going to focus on some common approaches to data governance. And through these two objectives, we're going to be sharing some tips of how this can be relevant to the work we do as organizations in the public health space. So I mentioned at the start of the presentation that this webinar is part of work we've been doing to explore organizational capacity for health equity. We have conducted a couple of webinars already related to this. Our past webinars have provided an overview of the practice framework you see on your screen. We've also done some specific conversations examining the kinds of organizational values which support health equity, as well as how we communicate and sustain health equity-related change within organizations. You can find recordings of the past webinars on our website. For today's conversation, as I mentioned, we're going to be focusing specifically on governance. And so this is an issue which the Learning Circle, which is part of this project, had explored a few months ago. And we had a few guiding questions to frame our conversation. We were interested in exploring the principles and practices for governing for health equity, with a particular interest in how people with lived experience, so people who are often the target of marginalizing policies and practices, like how could we, what kinds of practices will ensure that people with lived experience will be equitably involved in ongoing decision-making processes. So with this in mind, and with those objectives, I'm going to spend some time really just grounding us in what we mean by governance in the first place, walking us through some core principles as well as some key elements for how this can be applied in organizational settings. Following that, I'm going to pass it on to Jodi, who is going to walk us through some different models and ways of thinking about data governance. So if you have questions as we go, you can feel free to drop them in the chat box, and we will take them at the end of the presentation. We'll also have some time in between mine and Jodi's, and you and Jodi's, for any questions which you have. So first up, what do we mean by governance? I think simply put, governance is really centered around decision-making. So it's both the process and outcome of decision-making. I really like this definition, which comes from Delu, and she talks about governance sometimes being very intangible, and it's simply put like just the way things are done around here. So oftentimes governance can be really formalized, and in organizations we can think about, say, our boards of health or our boards of directors as a really formalized structure of governance within public health organizations. But it's also everyday processes of decision-making. And the first definition here talks about the fact that governance can be about what decisions are implemented and also what we don't do. And so really we're thinking about how power shows up in our work on a daily basis in terms of who gets to make the decisions, how the decisions are made, and what the outcomes of those decisions are. So in our early explorations in this area, we started thinking about what governance within organizations could look like. And so some work coming out of the Bay Area in the U.S. talks about some really integral components of governance at an organizational level. So they stress the importance of having health equity being part of strategic plans, mission statements, and value statements, and the need for this to really be clear and goal-oriented and to have some benchmarks for which the organization can measure its progress. In terms of formal bodies, it's really essential that these formal bodies, like boards of directors, are really being guided by principles of equity, inclusion, and anti-oppression. And so here questions of representation on those boards becomes really integral. So looking at our boards and saying who is part of this board and what criteria is the board using to make everyday decisions. As well, it's important that the institutional practices themselves reflect a commitment to address health equity. And I find the other point particularly relevant for a lot of public health organizations. A lot of us find ourselves in systems where we're part of larger health systems. So really having this express commitment to primary prevention and to action on the social determinants of health is a really essential component of governing for health equity. As well, no surprise here, it's having organizational leaders really be health equity champions is essential. And in speaking about organizational leadership, how do we think about continuing that kind of health equity-oriented leadership as leaders come and go, so really embedding that into the fabric of the organization's work. So I'd like to get a sense from you. Which of these are present in your organization? Does your organization have a strategic plan or mission statement which clearly includes health equity? Do you have equity included as a governing principle for your boards? Are institutional practices reflective of equity? So Ashko, if we can just have that first slide, and we'd love to see how this is being taken up in your own organization. Okay, great. So we see some responses coming in. So, yeah, so we're seeing here a lot of people indicating that their strategic plans or mission statements do have health equity included. And as I can think of, I think a lot of organizations are really starting to pay attention to that, and you're seeing more and more of express statements about health equity in the mission statements of a lot of public health organizations. So in terms of organizational leaders being champions, about 10%, so that doesn't seem to be happening across the board. And so I find it interesting that we're seeing, just based on the little poll we have going here, that we're seeing health equity being incorporated into strategic plans and mission statements, and that seems to be translating into practices in a bit slower, right? So I'm seeing a gap between how this shows up in our practices and the mission and vision statements which organizations have. So I think that's a really interesting point of reflection for us, is how do we translate these strategic plans into concrete practices. So for the rest of my presentation, I think what I'm going to be talking about are some ways in which we can start to integrate health equity in more concrete ways into our governance. So thanks, Ashakor, for the slides, and we'll move on to the next slide. So as you can see from the past slide, I think governing for health equity is really multifaceted, and it involves a whole host of players. So we have to think about the responsibilities, which are both individual responsibilities and the responsibilities which are shared within our organizations. And while we may be in a specific organization, because we're talking about the social determinants of health and health equity, we're always trying to work in partnership with different sectors, with community. And so how do we think about those responsibilities which are shared? I think it's also important that this governing for health equity requires a long-term commitment. And so how does that get integrated into our ongoing governance? So work from the World Health Organization, which has been adopted, I think, fairly consistently in the social determinants of health space, they talk about some principles for good governance for action on the social determinants of health. They talk about the importance of legitimacy in voice, direction, performance, accountability, and fairness. So with regards to legitimacy of voice, I think it's really important that all the stakeholders, so really anyone who's going to be affected by the decisions being made, is included in a process which is considered legitimate, a participatory process which is legitimate. And so particularly communities who are targeted by marginalizing policies, practices, and processes really need to be at the heart of the decision making. As well, partners need to be involved, particularly for working family issue and housing. We know that we cannot do that alone. So how do we actually involve partners in the way our governance structures are set up? I live in Toronto. I've lived in Toronto, I think, for the last 18 years or so. And I often think about the fact that in the city of Toronto, we have these community engagement processes in the city, which are designed, sometimes public health is a part of that, but they're usually public health or other departments in the city. And they're really designed to get that direct citizen voice as part of the decisions. And I can't help but think that usually when I get a notice in my building about a community consultation, I wonder, is my voice actually going to matter? Is my voice going to be heard? Or have the decisions been made before we even come to the consultation table? And when we look at the literature, we see that a lot of community members reflect the sense that it feels like decisions have been made and communities are being involved as just a way of legitimizing decisions which have already been made elsewhere. And we see that when communities provide input and there's no accountability for those either programs or policies then to be to be implemented. So I think that's a really important thing to think about, how these participatory processes can actually move towards concrete action. And participation for communities and for partners can also be a really good way to actively challenge power. So think about who normally makes decisions within the organization, within the setting in which you work. Are those people reflective of the communities you're serving? When we have direct community participation, it's a way for us to start to shift power from organizations into the direct hands of community. I think a second principle I'm going to speak about now is direction. So I think it's important that there's a clear vision and that this vision is long-term, and it really focuses on things that are beyond those short-term gains. So while it's important to celebrate our short-term goals, it has to be a longer-term vision. And for people who are in those decision-making roles, there needs to be a really strong understanding of the history of the community and the ways in which those issues are understood within that particular space, as well as the culture and the social context within which decisions are being made. I think performance is another really integral part. So here we're trying to balance both the process of decision-making as well as the outcomes. I think one of the things which happens sometimes is that we believe so much in the value of participation that we don't pay enough attention to whether or not this participatory process are actually yielding anything. And in some of the work we reviewed, researchers talked about how the people in charge of participatory process would say things like, you know what, the outcome did not even matter, but we're just so happy that we got a chance to engage, which on the surface sounds like a positive thing, but it's also a bit concerning if we're investing time and resources in engaging and in good governance and not paying attention to whether or not we're shifting our policies and practices. So, and that leads me to accountability. So everyone involved in making decisions needs a degree of accountability, which are grounded in shared goals, as well as whether or not they're making a difference in terms of health equity outcomes. And here we need to be transparent, and we can do so by integrating it into our work plans, by setting very public benchmarks. And I'm seeing more and more organizations actually saying, here's what we're committing to do, and we're committing to reporting on this. And what that does is it helps communities, it helps the public actually hold us to account and go back and say, well, you promised you're going to do an affordable housing-related policy. Has that happened? What was the impact of that? What worked well? What didn't work well? And how can we shift that? So that benchmarking and reporting is a really important way through which we can ensure our accountability in the work we do. The last good principle for good governance is fairness. And here it's ensuring that the processes of decision-making and implementation are actually equitable, so that we're having fair representation across gender, across race, across ability, and again, using the processes in ways which are equitable. I'm going to speak a bit more about that later, so some ideas about how we can ensure some more equitable processes. So if we think about those 5 principles I just discussed, how can we bring this to bear within our organizations? So in our work, we identified 5, and these are by no means exclusive, and they do overlap to some degree. So they include the need for a strong evidence-based and effective data governance, which Jodi is going to be speaking to data governance specifically, community participation, the need for strategic intersectoral partnerships, the need for transparency, which I spoke to a bit already, and the importance of having structures within the organization which enable learning. I'm going to begin with authentic community participation. So I think it's no surprise to us that while community participation is something which we aspire to in public health, and we aspire to do it well, community participation is not without its barriers. So oftentimes communities speak to the power imbalances which exist between communities and between professionals. The fact that as professionals we often use language which excludes community. So language which community members may not necessarily understand. Community participation requires time and resources. And there is, I think, on the part of communities, a skepticism that the input they're providing will actually make a difference in terms of professional or organizational organizational decisions. Also, we're often going to people who already are able to be better organized, and so then that skews the kind of participation we get. So often, people who are at the who are the most marginalized are often excluded from participatory processes, and we're not always getting the diversity of the communities we are trying to serve. I think another big challenge here is that sometimes the community participation is limited to the planning phase, and then there's no accountability for any results or for any implementation. So with this barriers in mind, what can we do to ensure that to enable more authentic forms of community participation in governance? So I think a lot of us are familiar with the different levels of community participation. I think moving towards a place where community actually has decision-making power. So we're trying to do work, we're trying to govern in ways where we're in partnership with community, or power is delegated to community, or actually move into complete community control. And Einstein, who does ladder participation, argues that that is really what constitutes genuine and authentic community participation. So how do we do this? I think it's important for us to understand the historical context within which we're working, as well as the impact of any past policies or practices before we go about engaging community in governance. We also need to think about the kinds of barriers community members may have in terms of participation and remove some of those. For ourselves as professionals, as organizations, I think it's really important to engage in reflection, an ongoing reflection about how we define communities in the first place, and how we ensure a really broad representation of different community voices. So are we going to the people we just already have pre-established relationships with, who we think will be the most malleable, right? Who will not challenge our pre-existing ideas. So while we want to work with community leaders, we need to ensure that we're balancing that and not just having people who are going to be like, oh yes, organization X, you're doing a great job, onwards. So how do we pay attention to dissenting voices in our participatory processes? Another important bit is building community relationships before we're in crisis, before something is a present issue to address. So investing the time ahead of the game to develop those relationships, so that when we go into communities, we're trying to work with communities and engage them in governance, we already have trust established, and we have a working relationship. We're not just going there to demand things from communities who are already quite stressed. I think another way in which organizations can really tap into authentic community participation is by listening to the outside and within. So within a lot of our organizations, we have people with lived experience. So how do we listen to those voices and really hear them in terms of decision making? And generally, I would say that the more participatory our processes are, the more likely we are to better include community voices in more authentic ways. So as organizations, we can ask ourselves a number of questions. So I'm thinking really about where you are as an organization and what you've done in the past to engage community governance, and how has that worked? Has it worked? Has it been successful or not? And really actively considering those barriers to participation, and thinking about how we balance community voice with our own expertise, and really questioning whether or not our expertise should be the one which should be what takes precedent, or if community voice gets to determine where we go. So there are a few resources we have here, which you'll get in the slide decks, which I think just provide some more guidance in terms of authentic community participation. So I'd like to talk a little bit about strategic partnerships. So as we know, I think we're all trying to work in partnership with other sectors. And when we do that, how do we think about working in ways which are supportive? So one of the things which I think other sectors experience is, this healthism. So we go in there saying, pay attention to health equity because it's really important. And of course it is. We know that there are profound health inequalities, but how do we start to emphasize not necessarily health, which we care about, but the points of commonality, those are shared interests, our shared values, and our shared objectives. And I think when we do that, we can start to find some really good entry points with other sectors. I think political support is really important in this, in terms of strategic intersectoral action, and investing in building alliances, and in those alliances with other sectors, really moving towards a process of consensus building. So thinking about if you're working with, say, the education sector, what are they gaining from that relationship with you, and how do you get to a place of some mutual benefit? I think we sometimes get into these partnerships thinking that we need to educate other sectors about health equity. But in my experience, I think there's a lot we can learn from other sectors who have been tackling issues of equity for a very long time. Obviously coming into it from their own lens. It's either from a housing lens, or from an education lens, or from an employment or labor lens. So what can we learn from those approaches, and how can we use those as entry points into our work? I think another issue with intersectoral action is a lot of organizations are compartmentalized, and we talk about joint up action and how we work across, but there may be times when we are actually just trying to work with individual sectors because what we're trying to do aligns better with them. So it's really balancing those approaches, and also working towards building those interpersonal relationships with across sectors. I'd like to spend the next few minutes talking about transparency, and I think this really relates to the point earlier about accountability. So oftentimes, as organizations, we set our goals, and one of the ways in which we ensure accountability is by being transparent about what we are doing. And so at the local level, it's really important that we have access to data, to information, so ensuring that free flow of information across the board to the public and also with other institutional actors, because then that helps us actually understand the issue and monitor at our progress. And this holds true at the local level, at the provincial level, at the national level, and even at the global level. And as we share this information, it's important that that information is presented in ways which are easily understood and available to community. And related to that is making sure that our decision-making processes are explicit. So do we have a clear sense about how the decisions are going to be made? And the last bit there is about instituting having a process in place which is transparent, so ensuring that everyone involved knows how the decision is going to be made and how they can contribute to that decision-making process. So I'd like to get a sense from you about your own organizational context. Which of this do you have in place within your organization? If you're involved in data collection, is that information available and accessible to communities? Are decision-making processes explicit? And do you have some participatory governance processes already in place? Okay, thank you. We have 3 options there. All right, great. So a lot of folks are indicating here that the data which is collected is available and accessible to community, which is really, really encouraging to see. And also that there is some level of participatory processes are in place. And a few less people are indicating that the ways in which decisions are made are explicit to all involved. So again, I think that really shows that that's something which we need to be paying attention to, really making that decision-making process transparent. Great, thank you. So I think one of the ways in which we can move towards the more transparency and accountability within decision-making is really providing space within our organizations for ongoing learning and for organizational change. So in terms of learning, I think we need mechanisms in place for feedback, for learning, and for improvement. And so that could be done by, say, establishing structures within organizations and across organizations where we can learn and share with each other. And I think, again, this needs to be done in partnership with communities who are affected as well as with other partners. And more concretely within the organizational context, This learning can be captured in, say, performance plans, in training plans, and also in ongoing performance reviews. And I think that's one way in which we can actually integrate it into our learning system. With regards to organizational structures, I think there's this ongoing conversation about where do we place health equity governance within organizations. So a lot of you on the line are part of, health equity units and are supporting work in that way. So that could be really good because it provides the organization with this, department which is responsible for health equity work. But it can also have the unexpected consequence of really separating health equity work from the rest of the organization. So it's important that that health equity work is integrated with other parts of the organization. If we think just slightly beyond our organization, sometimes there's this conversation about centralization or decentralization. So does health equity work get governed at sort of a larger governmental level, or does it go down to more local authorities? And so in that case, sometimes this sort of decentralization has sometimes been a way for national governments to upload fiscal financial responsibility to local governments. So that's just something which we need to keep in mind and weigh those tensions. And there's no real, I don't think there's really any strong evidence that one approach is better than the other or leads to, say, better health outcomes. So if we think about the importance of participation, then you can see why sort of local decision making would be important. But that just needs to be very well resourced and supported by a more, larger policies. So I'd like to end my section and pass it on to Jodi just by talking a bit about the importance of strong evidence-based and effective governance. So I really love this quote here, which is from the United Nations. And it talks about data being the lifeblood of decision-making and the raw material for accountability. And that without high-quality data, which provides the right information on the right trend at the right time, we're not able to monitor the policies we have in place. So on that note, I'd like to welcome Jodi and invite her to walk us through a conversation on data governance. And I really like the title of her presentation, which is Hierarchies, Partnerships, or Commons. Welcome, Jodi.